loves, welcome back to my YouTube channel, #NurseGirls. It's me, Janicia, and I'm back with another video. So for this video, guys, you might want to turn up the volume because I'm in the library and I will be showing you guys how to make drug cards for pharmacology. So it's best to use drug cards that are 4x6, and the way that I have it is color coded. So I have like these highlighter, like yellow looking colors. I have orange, hot pink, and then I have a green. So the reason why I have them color coded is because I want them to be in their certain classes, and you already know that there's a certain class for each drug. So this is how they look. I might have horrible handwriting, but this is just to give you guys like an overview of how they're going to look at the end, but I will go through one full drug card with you for this video. So a few things that you would need to go on your drug card. You would need the generic name, which is normally lowercase, the trade name, which is normally capitalized, and it could be more than one. And then you would need the therapeutic response, which is how the drug is supposed to affect the body, so the positive way that the drug is affecting the body. The mechanism of action, which is just like defined as like how the receptors and the enzymes work. And then you'll need the pharmacokinetics of the drug, which is how the body could either metabolize, distribute, excrete. Pharmacokinetics that would include the route, the duration, the peak, and also the onset of the drug. Alright, and then what I put on the back of the drug card, which you can probably fit all of your stuff on this card. It just depends on how big or how small that you write. You will also need the adverse effects and also interventions, nursing interventions, and that's just like something that you would do to either educate the patient or something that you have to do as far as like monitoring the patient's value, lab values, and things of that sort. If you have a drug book, you can look it up, and it should have literally everything that you need listed for you. Only thing you have to do is copy and paste. Also, if you don't have a drug book, you can always go online and look for your drugs online. I know they have, I think it's called RX Medlist. You can go online and look at that. So I've already put methadone as the generic name here at the top. I'm going to put the trade names at the bottom of it, and then I'm going to start writing down the mechanism of action. And the mechanism of action for methadones, it binds to depressed opiate receptors in the spinal cord and alters the perception of pain. Okay guys, so the next thing you need to write down is the therapeutic response, and that's just simply telling you exactly what the medication does or what it's used for. And methadone is used as a opioid detoxification. Then I'm going to write down the pharmacokinetics, which is like the route, as I was explaining before, the route, duration, onset, and the peak. So for methadone, you can take it PO or IM, which is intramuscular, and the onset would be 30 to 60 minutes. For PO, the peak would be an hour and a half to 2 hours, and then the duration lasts about 22 hours to 48 hours. So yes, I'm gonna write that down and I'll come back. Okay, so I pretty much just went ahead and did the whole drug card because it was taking too long. So as you can see here, I abbreviated a lot of things, which is smart to do. Abbreviate so you don't have to write a lot. Okay, make sure that you guys also put your name at the bottom, just in case you might lose one, somebody can return it to you. So on the back of the card, I have the adverse effects and also the nursing interventions or the implications. So for the adverse effects, I literally just put down the ones that are common and that are, I guess, the most severe. So confusion, seizures, respiratory depression, constipation, hypotension is all the things that I put down. You can put down as many as you would like, but those are the ones that I put down specifically for this drug. For interventions, I put to assess the patient for the relief of chronic pain, severe pain. Make sure that you're doing around-the-clock dosing and not just like once a day. Also, I put down, hold on, not to discontinue the medication abruptly. You know, that could cause severe adverse effects, or the patient could go into a withdrawal stage, which is, of course, not, you know, what we want for the patient. Also, I put down to report back to your physician if you have any of the adverse effects, like if it becomes more severe. So those are some things that you could do. Also, you could monitor the patient's vital signs, and making sure that you're always asking the patient, are they feeling any pain, or is the pain getting better, the pain scale. Alright guys, so that's pretty much how I make my drug cards. If you have any questions, don't hesitate. Leave a comment down below. I'm going to show you the pharmacology book that we are using. So we're using this book for pharmacology. I know it's kind of backwards, but it's by Lily, Rainforth Collins, and Cinder. And they also have an Evolve website that you can go and do practice questions on there. So y'all, I did not forget to do my dance. Here we go. With the gang, I with the mob. What was you thinking? Remember them days and that shit was hard. A nigga been thinking. I put a 4 in a 20 ounce. A nigga. Y'all, I legit like crack myself up. I'm in a library. Okay, loves, this includes my video. Don't forget to subscribe and hit that notification bell so you can get a notification every time I post a video. Leave a comment down below. Like and share this. See me with the game, we ain't playing fair. Matter of fact, we don't play at all. OG was in the air, but we better.